ever heard the term body dysmorphia? It's when someone has an extremely distorted view of what their body truly, in actuality, looks like. Now there is a thing, it's a sign of the times, my friend, apparently called Snapchat dysmorphia. Basically, folks becoming obsessed with their appearance because of what they look like through these Snapchat filters. So much so, are you ready for this? They are taking those photos to plastic surgeons and asking the doctor to make them look like their filtered image. This is from new research out from the Journal of the American Medical Association. We're not making this up. Joining me now, somebody who's seeing this himself, Dr. Tony Yoon, a board-certified plastic surgeon. Your job is to take what people's images of themselves and make it better. Were you even flabbergasted when you started to see this trend? Is this actually happening in your office?
Yeah, this is a very disturbing trend that we're seeing more and more. And typically it's young people who bring pictures of themselves, and they're even bringing pictures of celebrities who've been filtered. And they say, hey, look, I've got a picture on my phone. Make me look like this celebrity or make me look like myself with this great filter.
And so you would pick up your chin off of your chest, fix your face, and how do you respond to them?
Well, I mean, we want to be realistic with them. And some of these people, they do have true psychological problems. And so when we try to talk to them and recognize that this is unrealistic, sometimes they listen, other times they don't. I mean, it really is getting to the point where honestly, it's pretty ridiculous. I get patients, you think they want to look good from the front, but I get patients who take a picture of them from way back here and they say, I know I look great from the front, but I want to look good from this angle, and there's this little wrinkle here that doesn't look right. Get rid of that for me.
So, I mean, let me ask you, is it making you question what you do for a living? I mean, all of us have that point at some point in our career. We look and think, what has this become? How are you managing this? Because if this is a trend that you're seeing increasing, you're going to lose business because it sounds like you're not going to be able to fulfill their wishes.
Yeah, and this really is the unrealistic pursuit of perfection, and that's something that a lot of plastic surgery patients, they try to acquire. And 1% of the population have body dysmorphia. We estimate that about 10% of the plastic surgery population have body dysmorphia. And I would say that of those people who have selfie dysmorphia, true body dysmorphia is probably anywhere from 30 to 40% or maybe even more of them.
God.
So, they don't need a plastic surgeon. They need a psychologist or psychiatrist, unfortunately.
But here's the problem, though. You know this just as well as I do. You're an upstanding professional with years in the business who board certified, respected by his colleagues and by your patients. You're going to say no to these folks. They'll find somebody who will do it.
Yeah, and what I tell them is I say, look, it's not as easy as going to the barber and getting a haircut or to the beautician. If you have these, and typically what they look for are injections of filler or Botox, you can get scarring from it. You can even, in a bad situation, get loss of parts of your nose, parts of your lips can necrose and fall off, and people have gone blind from injections of filler. So I try to tell them, look, you got to take this seriously. It's not as simple as what you see, as literally as simple as taking this filter and erasing the wrinkles off your face. It's much more serious than that.
And do you have some pamphlets there that you can give out to some colleagues that might be able to help them with the body dysmorphia stuff? Because I imagine that's another part of what you're trying to do, is have a conversation with them about loving themselves in their imperfect, perfect nature,
Exactly. And really it comes down to that true happiness comes from within yourself, not from having the perfect selfie.
Yeah, absolutely. Wow, Dr. Yoon, this is a moment in time, and we hope truly it is a moment in time, a flash in the pan. Honey, love yourself. You're fearfully and wonderfully made just the way you are. All right, good to talk to you.